Between the wealthiest and poorest counties in Appalachia, there is a difference in 7 years in the average life expectancy. This means for those living in the bottom or poorest 10%, they will live on average 7 years less than their wealthier counterparts. That 7 years less is spent to friends, family, and loved ones. I think we can all agree that this gap is completely unacceptable, but what we're seeing is actually a fairly well-known public health phenomena, particularly when we're looking at national data. This is true because wealthier counties tend to have better health outcomes. And this applies for everything from average life expectancy, the prevalence of chronic and infectious diseases, and even accessibility of healthcare. Now, while this is known at a national level, very little research has been done at a regional level, specifically in regions like Appalachia. That's where my research comes in. We're aiming to bridge that gap. We wanted to understand how the 423 counties of Appalachia are uniquely impacted by wealth disparities, especially given Appalachia's unique pool of wealth and health disparities. In order to do this, we started with 3 key economic indicators that we looked at across every county in Appalachia: poverty rate, unemployment, and per capita market income. Using these 3 metrics, we're able to get a snapshot of how a county is performing economically. With that, we were then able to rank all counties from best economic performance down to the worst. We then took from this list the top 10% and bottom 10% and separated them from the rest. Within these 2 groups, we then averaged a number of health statistics so that way we could clearly go between the wealthiest counties in Appalachia and the poorest, how does their health differ? We then conducted a statistical analysis, and in this analysis, we found across every single variable, there's a statistically significant difference between the wealthiest and poorest counties. More specifically, the wealthier counties were significantly healthier than their poorer counterparts. So what do we actually do with this information? Well, the good news is this research has also looked at a national level, has already provided guidance on how we can begin to close this gap in Appalachia. To do this, we have to invest in our counties. There are 3 key areas we can focus in: job opportunities, education, and development of local infrastructure. By investing in these areas, not only will we begin to increase the economic status of each of these counties, reducing that gap, but will by extension also improve their health, as research has shown time and time again. So, to bring it all back to one point, if we continue to invest in Appalachia and those poorest counties, we can reduce that 7-year gap. We can give people back years of their life that they may not have otherwise. That means 7 more years spent with their friends, family, loved ones, and make memories and make life so worth living. So, the main takeaway I want you all to have is if we invest in Appalachia, we can give people more time to enjoy the beautiful mountains we all call home. Thank you.